Hi, my name is Nicole Fry, registered nurse. I'm going to be talking about nutrition for optimal fertility. Nutrition has an impact on female fertility, as we all know. However, there's no one specific food or beverage that will make you more fertile or not. Approximately 12% of primary infertility is caused by dysfunctional ovulation and is a result of incorrect weight. Decreased weight, low weight, is related to hypothalamic dysfunction and reproductive irregularities, whereas increasing your trans fats by approximately 2% can increase your risk of infertility by 131%. We've talked about how infertility affects couples, and approximately 1 in every 6 couples is impacted through infertility, and our diets are high in caloric density, high in saturated fats, and tend to have lower essential vitamins and minerals than we would really like to see. As far as fertility in the males is concerned, underweight and overweight men are also at risk for decreased sperm count. There are a few super female fertility foods that I do like to talk about. One is your folic acid. All women of childbearing age should be consuming at least 800 micrograms of folic acid daily to help prevent spina bifida. Folic acid can be found in most fortified cereals, leafy greens, whole grains, wheat germ, soy, and citrus fruits. Another great fertility food for the female is vitamin E, which is also found in your whole grains, broccoli, alfalfa, nuts, wheat germ, and leafy greens and soy. Moving on to vitamin A, which is really found in your cruciferous vegetables such as broccoli, Brussels sprouts, cabbage, bok choy, your collards, kale, and cauliflower. Then we'd like to remind you about iron, which can be found in most red meats, alfalfa, and leafy greens such as spinach. There's zinc, which can be found in wheat germ seeds such as sunflower and soy. And then your essential fatty acids, which are found in things such as safflower and other vegetable oils, and even in avocados. Some of the super male fertility foods, 3 that I'd really like to talk about, the first being vitamin C, which is found in your citrus fruits, your orange juice, your lemons, your cruciferous vegetables, and alfalfa. We've got vitamin D, again found with alfalfa, dairy products, salmon, and calcium, which can be found in dairy products and soy. Moving right along, I'd like to just discuss how alcohol affects female fertility. So alcohol can impair the function of the glands, the hypothalamus and the pituitary, which release the all-important reproductive hormones, in addition to affecting the function of the body's other endocrine glands. Decreased conception rates occur even with weekly alcohol intake of 5 or fewer drinks per week, resulting in inadequate functioning of the ovaries with chronic to heavy drinking. Alcohol can lead to early menopause, increase the risk of miscarriage if you are pregnant, and interestingly enough, it negatively impacts your libido or sex drive. As far as how alcohol affects the male reproductive system, it results in inadequate functioning of the testes. It can reduce your testosterone level in men. It may interfere with normal sperm structure and the movement by inhibiting adequate metabolism of vitamin A, and again, as in the female, it impacts your libido. Optimal weight. So when we talk about optimal weight, what we discuss is your BMI, or your body mass index. The body mass index is calculated by dividing your weight by your height in inches times your squared times 730, which is an awful long calculation. Or you could just find a nifty BMI chart and find your height on one column and your weight in the other and come up with your number. Optimal weight BMI range, we're really looking between 18.5 and 24.9. Anything under that is considered underweight, anything over is overweight, And should your BMI happen to be greater than 30, that is technically considered obese. Pregnancy outcomes are definitely related to your weight. So we see when we have women who have higher weight levels, their rate of cesarean goes up significantly. For a female who is under 40 years of age, who is obese, or her risk of cesarean delivery is approximately 70%. In addition to cesarean deliveries, women who are obese have higher preterm delivery rates, increased rates of gestational diabetes, and increased rates of gestational hypertension. Some lifestyle factors that impact fertility are avoiding saturated and trans fats, increasing your monosaturated fats such as olive oil, nuts, and avocados, avoiding excess sugar and refined carbohydrates, your white bread, sodas, high fructose corn syrup, pretty much anything you find in the middle of your grocery aisle. Protein should come from vegetables as opposed to red meats, so protein sources are beans and lentils. And then increase your consumption of high fiber foods, such as fruits, vegetables, and whole grains. People often ask, well, what if I drink juice or vegetable juice? There's approximately 6 oranges in a glass of orange juice, if not more. When you're considering you're taking out the pulp, you're taking out a lot of the fiber, you're really losing a lot of its nutritional benefits. So eating the food in its pure state is really the best for you. Additional things that you can help to control your weight are exercising at least 30 minutes per day, staying within the optimal body fat percentage and BMI range, avoiding crash diets, sugar spikes, and rapid weight fluctuations, and really learning to manage your stress. Some strategies for weight loss that I like to recommend are make a commitment, not only to yourself, but to your partner or a friend or a family member, so that somebody else knows what your goals are. Find your inner motivation. This could be anything from a trip you have planned to getting your nails done, some sort of motivation for losing this weight. In your cases, it's most likely the motivation to have a child. Don't forget to be realistic when setting your weight goals. If you weigh 150 pounds and you maybe need to lose 5 or 10 pounds, depending on your height, to be realistic. Don't think that weight's going to come off in a week. Give yourself months to take that weight off. Try enjoying the healthier foods. Experiment with different foods such as any of the listed foods that I'd mentioned, alfalfa, for instance. Not many people eat that. Try different nuts, different types of whole grains. Try cooking with one different food per week and seeing if it's something that you like. Get active and stay active. This is the hardest part. Whenever you jump into a weight loss program, people are always really geared up and ready to go in the beginning. And then as time progresses, it starts to wane away, that activity and that energy and the enthusiasm. But try to stay active. Find an activity that you enjoy doing yourself. And then the other thing you need to do is change your perspective. If you go to a birthday party, that does not mean you're required to eat birthday cake. You can simply enjoy some nice conversation and eat some of the healthier food options available. So changing your perspective on how you look at things. Portion control is another major problem affecting the American diet. When we go to a restaurant, we generally assume that the serving in front of us is one serving, when in reality, if you go to a restaurant, the serving of pasta laid out in front of you is most likely equivalent to that of 4 servings of pasta. Take a moment to look at your food labels, see what's written on them, and really analyze how much you're eating. Once you really start to take into effect how much you're eating and realize that you're eating more portions than you actually need, you'll start to see that weight fly off. And then my last little bit of advice is on food journaling. If you're really having a tough time, you can't seem to lose those pounds, keep a journal. Keep a 3 to 5 day journal, and then go back with a clean head a few days later and analyze it. In that food journal, you should have written down what you ate every day, what time you ate, and also what you drank. If, for instance, you made yourself a turkey sandwich, what you would want to write down is 2 slices of whole wheat bread, 4 slices of oven roasted turkey, 2 slices of Swiss cheese, 1 leaf of lettuce, 2 slices of tomato, 3 tablespoons of mayo, and 1 teaspoon of mustard. That way, going back, you can look at it and see and calculate exactly how many calories you have. That would really be the end of this presentation as far as nutrition and fertility is concerned. If you have additional questions, please don't ever hesitate to reach out to us at FSMG. You can call us at 858-505-5500. Thanks and have a lovely day.